Attention deficit hyperactivity disorder. There's a mouthful. You might know it as ADHD, a brain condition that begins in childhood and may affect as many as 10% of school-age kids. ADHD is not a life-threatening disease, but if it goes untreated, it can lead to problems in later life, including learning disorders, depression, anxiety, and drug abuse. Experts still aren't sure what causes ADHD. They know it's partly genetic, but that doesn't mean affected parents always have affected kids. It's thought that if a mother drinks or smokes during pregnancy, her child's risk of having ADHD is increased. Environmental toxins like lead and PCBs may also play a role. Contrary to common myth, a high-sugar diet does not cause ADHD, nor does watching a lot of TV or having an undiagnosed food allergy. The symptoms of childhood ADHD are broken into 3 categories: inattention, hyperactivity, and impulsivity. Let's take a few examples from each. Inattention is characterized by forgetfulness about chores, difficulty sitting still or listening to instructions, and losing personal items. Hyperactive behaviors include fidgeting, restlessness, and excessive talking. Impulsivity manifests as shouting out answers before the question is finished, impatience with waiting in line, and interrupting conversations. You might think, hey, isn't that just kids being kids? I mean, don't all kids fidget and jabber and jump the line every now and then? The distinction is made when these behaviors are regular or severe enough to disrupt the child's ability to learn and to interact with others. At that point, we're dealing not with the normal exuberance of a healthy kid, but with the condition known as ADHD. When it persists in adults, the symptoms are a little different. Anxiety, low self-esteem, depression, anger management problems, and relationship issues are the main ones. In most cases, treatment will consist of medication and psychosocial therapies. These are lifestyle changes that encourage more normal behaviors. Stimulants are the most common drugs prescribed for ADHD. Your doctor will advise you on any possible side effects. Of course, medication is only half the story. Special education consists of a tightly structured environment and an emphasis on timekeeping and routine. Counseling, which often includes the parents as well as the child, can help with the frustration and anger sometimes triggered by the illness. Remember that ADHD can spell big trouble in later life if it's not diagnosed and treated, so if you feel your little one's natural energy might be spilling over into something less healthy, reach out to your doctor.